the podium who has demonstrated both empathy and action in the United States Senate. Senator Cornyn was co-founder and continues to be co-chair of the bipartisan Senate caucus on community health centers. His work at the Capitol advocating for community health centers led the National Association of Community Health Centers to recognize the senator with the Distinguished Community Health Leadership Award in 2016. So thank you so much for joining us today, Senator Cornyn, and allowing us to celebrate the way the CARES Act has impacted our community for good.
Thank you, Dr. Griggs, and it's good to be back in Waco and with such a distinguished group of leaders. And this has been quite a perplexing and challenging few months, to be sure. You know, we had the best economy in the nation, 3.5% unemployment. After COVID-19 hit and we had to undertake the mitigation measures that we're all familiar with, our unemployment went up to 13.5%. I believe that's approximately correct. And a lot of people, through no fault of their own, found themselves without a paycheck and experiencing a lot of anxiety about where that next paycheck would come from. At the same time, this virus, which doesn't play by our rule book, has been a new experience for all of us. The closest thing to this has probably been 100 years ago in the great influenza crisis, 1917. But we have learned a lot, and we continue to learn a lot. It gives me a sense of gratitude and appreciation for our heroic healthcare providers on the front line, and certainly our community health centers are part of that heroic front line in the fight against COVID-19. I've always been a supporter of community health centers because I felt like they provided an important safety net for people, whether they had Medicare, Medicaid, or private insurance or no coverage at all. They can come here and get the primary health care that they need. So this community health center and in this community, like others around the state and the country, are integral to our efforts to keep our nation healthy, but also to fight this virus. So I think that the closest analogy I can think of is World War II, except now this is a domestic war where we have to deal with the public health consequences, and we also then have to deal with the economic consequences associated with it. The virus pretty clearly picks on elderly people and people with underlying chronic illness. One of the great ironies and mysteries of the virus is you may have it and not even know it. And so those are the so-called asymptomatic. The reason why that's dangerous, maybe not so much to you, but to others that you come in contact with, is you can come in contact with vulnerable people, over 80 with underlying chronic disease, and obviously that's dangerous. So we've learned a lot about protecting the most vulnerable, particularly skilled nursing facilities and nursing homes and places like that. We've also learned that you can't depend on foreign imports of medical equipment, things like personal protective equipment. Unbeknownst to me, PPE, as it's come to be known, is primarily made by China. And when China had the virus break out, they sat on that information, didn't share it with the World Health Organization. While they hoarded the PPE they knew they would need and they knew that the rest of the world would be competing for. So we've learned a lot about vulnerable supply chains. Congress is very much focused on the fact that we also depend for active ingredients in most common medications, depend on China to produce those. We've had this idea in our mind that if it's cheap, that's the best solution. Well, there are other considerations in addition to just being the cheapest source of that. We know testing continues to be a very important component, and I know as students are going back to school, testing remains very important. We're learning that there are different types of testing, and hopefully we will soon come up with a fast gold standard test, so there won't be as much confusion about what type of test should I get and what it actually means. But I mentioned the second front, and that's been the economic battle here. Through no fault of their own, people were out without a paycheck. And so Congress, when we passed the CARES Act in March, decided to send a direct payment to people making up to $75,000 a year could receive up to $1,200. Family of 4, up to $3,400. That was a lifeline to those folks, the type of people I mentioned who, through no fault of their own, didn't have any income, didn't know where the next paycheck was coming from. Secondly, we enhanced unemployment insurance benefits. We've seen a huge run at on the Texas Workforce Commission that administers the unemployment insurance compensation system, but we knew that was an important piece of it. The next important piece was the Paycheck Protection Program. This was designed to help smaller businesses maintain their payroll. Again, another way of keeping people having money coming in the front door. And it was fabulously successful. We've never done anything quite like this. Vote for $3 trillion worth of spending in an emergency like this, but we knew we had to go bold. We knew we had to do it quickly. And the Paycheck Protection Program, which is a low-interest loan that can be converted to a grant, was so successful that $350 billion was depleted in 2 weeks. And so we replenished it with an additional $320 billion to provide additional help. But we didn't know how long this was all going to last. We hoped it would be a short-term prospect, but it has turned out to be longer than we thought. That's why it's so important to pass the next installment of COVID-19 response. I'm on a conference call every morning with Secretary of Treasury Mnuchin and White House Chief of Staff Mark Meadows, along with some of my colleagues, and they report on the status of negotiations. We were pretty much at an impasse until recently, when increased concerns about funding for the post office came to the forefront, something that frankly is not a partisan issue. And it sounds like the House is going to move a bill very soon. And if they do, we will add to it some of the most popular consensus items like direct payments to individuals, the PPP extension, and other elements that really, frankly, are consensus solutions to the problem. So I'm more optimistic as I stand before you now than I have been in a long time about that success. We've been doing really well. We passed most of the first 4 bills with bipartisan support, almost unanimous support. And then the proximity of the upcoming election sort of tempted people into their bad habits of partisan dysfunction. But hopefully we'll be able to overcome that in the public interest. So I just wanted to lay out why Congress did what we did, and I think you'll probably hear more from people who will speak after me about the specific use of these funds. And this is very useful information to me as we go back and look at how we can make things better, what we need to continue, and what is not working. So thank you for having me.
Isn't it nice to have a U.S. Senator who understands the virus and the details of the virus and the public health problems associated with the virus so well? Federally qualified health centers deal with complex, daunting challenges of intertwined social, mental health, and physical problems affecting America's most vulnerable every day. It's hard work. And now imagine overlying on top of that, superimposed on that hard work, a pandemic affecting everyone in unique ways. While community-oriented primary care is difficult in any era, it's been uniquely challenging for our organization during this period of time. The Family Health Center has tested over 7,400 individuals in our community and has had over 1,500 positive cases. Among those that are positive, 53% are completely uninsured. The pandemic has led to unexpected operating costs and lost revenue for our organization, yielding major financial hardships for us. So the CARES Act and accompanying federal funding, accounting an aggregate of over $3 million, has helped equip us to serve our community. It has supplied 187,000 pieces of personal protective equipment to doctors, nurse practitioners, physician assistants, nurses, dentists, dental assistants, and social workers. It has provided equipment and kits to support 6,700 coronavirus tests to prevent dire testing shortages. It's allowed us to test everyone who comes in with COVID-19 symptoms. It has supplied mobile computer systems, tents, fans, air conditioning units, so we can see infected patients outdoors where contagion is minimal, in turn allowing those with chronic conditions most vulnerable to the virus to be seen indoors in a way that's safe. It has supported IT infrastructure at 15 sites, allowing us to develop and deploy telehealth infrastructure for our patients in record time. And CARES Act has provided nearly 11,000 hours of paid COVID leave to help our healthcare workers and other employees who have become ill or quarantined because of the coronavirus. In short, the CARES Act and related funding has provided a critical resource supporting our community's health. Well, I think we all know there are many miles yet to go before we reach the far side of this pandemic. I want to express deep gratitude to Senator Cornyn for his willingness to, as President George Washington said, feel the afflictions and distress of everyone and translate empathy into action in the Senate. Let me now introduce to the podium my friend and Mayor Pro Tem Andrea Bearfield to share some comments.
Thank you, Dr. Gray. On behalf of our Mayor Kyle Deaver and our City Council members, I'd like to thank you, Senator Cornyn, for visiting Waco and seeing the ways that COVID-19 has impacted our community and also the ways that we've been able to respond to this enormous challenge. And of course, I want to express our gratitude for the unprecedented funding that Congress has mobilized for the local governments across this nation. We've received direct federal funding for a number of programs, including $15.3 million for the Waco Regional Airport. This will help us operate and maintain our airport customer experience. In addition, these improvements help create new jobs in the aviation sector, as well as retain jobs locally that provide critical air transportation support. $7.95 million to the Waco Transit System that allowed us to maintain transit service that was absolutely essential to our community in a time where revenues and riderships are severely impacted. The ability to avoid relying too heavily on taxpayer dollars to keep the system operational is key in times like these. This frees up funds to focus on other critical services. Just over $803,000 in the Community Development Block Grant funds have allowed us to assist the most vulnerable within our community. We've been able to quarantine and house homeless individuals who are awaiting COVID test results or who have been tested positive. We've also been able to create a rent and a mortgage assistance program, and we were able to contribute a significant portion of those dollars to our local small business relief fund that was created in partnership with the Waco-McLennan County Economic Development Corporation. Over $428,000 was directed to the Waco Public Health District, Waco-McLennan County Public Health District, to hire support for our epidemiology team, purchase personal protective equipment, hire contract nursing staff so that we could increase capacity and support potential alternative care sites, and provide COVID-19 outreach and education to some of our high-risk populations. And $161,000 to our police department for their purchase of PPEs, thermometers, and related supplies. We are also appreciative of the Senator for his work in getting these funds appropriated. There is an additional $7.6 million in the Coronavirus Relief Fund available to Waco through the Texas Division of Emergency Management. They've unfortunately placed some additional restrictions on those that have made it a little more difficult for us and small to mid-sized cities across the state to maximize the full funding amounts the federal government intended for our communities. We want to thank you, Senator Cornyn, for your work on the current stimulus package that includes language that addresses this issue and reinforces Congress's original intent for those funds, that they move quickly in our communities to best help where needed the most. We need these funds for so many critical services. As you can see, we have a wonderful community that works together. And we want to keep people healthy, get them back on their feet, and back to work as quickly as possible. We thank you all for the work that you do and continue to do on behalf of our community. Thank you, sir.
Let me now introduce to you McLennan County Judge Scott Felton.
Well, if you're going to get hurt, this is a good place to get hurt. Well, first of all, I'd like to say welcome to McLennan County, Senator. And the Senator and I have worked on, this is our second disaster that we worked on. The first one was the West explosion, which was different than this, but a very serious and traumatic event for sure. The thing that I'm most impressed about how our federal government has performed in this situation is that they moved very quickly with Congress and working with the senators and our representatives. Congressman Bill Flores and Senator Cornyn and Senator Ted Cruz have all been all hands on deck, just like in the West explosion, and how we were able to get that community whole the best you can for the disaster that it was. The funding that comes into this community is so important. The Family Health Center, which is really a cornerstone of us growing our medical community, will definitely need support, and we'll have a great board led by Bill Clifton to be able to direct funds in the right direction to make this outcome the best it can be for the situation that we're in. The other thing is the city and the county, the city of Waco and the county have worked together, and thank you, Ashley, for your help, and Deidre and all the folks at the city bring a lot of resources to tackle situations that our community has to deal with from time to time. I also have reached out to other city managers and mayors with the other smaller communities that might not have quite the resources and depth of bench to be able to look into something like these grants, to be able to dig through them and get those dollars into this community. It's important, I think, for the county judge and the commissioners to be able to help those communities get every dollar that you possibly can get into this community that will give rewards back to us that we survive this, at least financially, not as scathed as we might otherwise. But one thing in particular, several years ago, former Mayor Malcolm Duncan and myself decided to redirect funding that was originally from the Texas Department of Transportation into HOTCOG for the Rural Transit Program, and we started up the Rural Transit District, which is very important. And I'll tell you why. And as the county judge, I sat on as chairman of the Waco McLennan County Economic Development Corporation, and so we call on prospects to come into this community. Our goal is to have a diverse economy, primarily of companies that bring in assets that can add to the community and not take away from the community. And to do that, one of the big questions that come up is how's our people going to get to work, how are they going to access health care, and all those things. And the fact that even though we're not a huge county, it still poses issues for some people to have transportation to getting back and forth to work, just like it is for people to get to Family Health Center to see doctors. And so this had just started. I feel like the Rural Transit District has done a great job in meeting the needs that we need to get, but in this times, of course, with ridership being down so dramatically that they've had financial struggles, and we cannot afford, we can't recreate these things. We got to hold together what we have. So I really appreciate how this is going to affect areas like the Rural Transit District and all. We'll continue to work with all the resources that we have to be able to understand how to maximize our opportunity to get these funds, and then look forward, Senator, for any future funding that comes in that could really help kind of finish this deal off. And we appreciate you very much, and if there's ever anything we can do for you, please let us know.
Thanks.
All right.
Invite to the podium President of Baylor University, Dr. Linda Livingstone.
Thank you, Jackson, for hosting us. It's wonderful to be here. And Senator Cornyn, thank you for joining us and just for your ongoing work and support. I don't know how much folks in this area know what a wonderful advocate Senator Cornyn has been, certainly for Baylor University, but for higher education more broadly across the state. We have a really exceptional higher education system in this state, and he's been a wonderful supporter of that. And certainly the work on the CARES Act has been critical to Baylor and to all of our institutions of higher education as we've worked to support our students and their families through the difficulties that they've experienced with the pandemic. You know, we have about 18,000 students. We unexpectedly, as everyone did, sent them all home about mid-March last year, and thought we'd get to bring them back very quickly, and obviously didn't. We are now just beginning to bring them back this week as we move them in for the fall, and are doing everything we can to make it work for them to stay through the fall semester on our campus. So the COVID-19 pandemic clearly had a significant impact on the well-being and the financial situation for our students and for their families, and so we are deeply grateful for the CARES Act funding and what it allowed us to do to help our students and their families through certainly some of the early days of this hardship. We've had to take many measures to create a new normal on our campus and with our students, and to help them to be successful while they were remote and now as they come back to us face to face. But this federal funding really helped us in two different ways. Really very significantly, over half of the nearly $10.8 million that we received in CARES funding went directly to our students to help them meet their financial needs. We were able to give 2,697 of our students aid from the CARES Act. This helped them pay their rent, it helped them buy food, it helped them ensure they had the technology that they needed, particularly while we were remote, to have computers and Wi-Fi, and really help them with their educational expenses so that they could continue their education. We know that's what they need most, is to finish those degrees so that they can go out and get really great jobs in the future. And it was helpful to them with their families as well. Many of their families had lost jobs and lost their financial resources. So very, very critical in the way we were able to help our individual students and their families. Another portion of the funds has been extremely helpful in helping us cover a portion of the university's expenses. We've invested multi-million dollars in protocols on our campus to help enhance the safety and health and well-being of our students and faculty and staff as we bring them back to campus. You mentioned tents. We've got lots of tents on our campus to give us more space. We've done lots of testing of our students, faculty, and staff. We'll continue that. Air filtration systems, and on and on and on. And so the CARES Act funding has been critical as a portion of the funds we've needed to help support the ongoing safety and health and well-being of our students on our campus. So we know this is it's a tremendous effort to have bills like this get through the system, and we are deeply appreciative of that and the impact that it's had, Senator Cornyn, and we certainly want to continue to work with you and others in Congress as these other bills go through. So anyway, we can help everyone understand the impact of these, how it helps our students. We want to do that. So thank you very much, and we look forward to a great fall semester at Baylor.
And finally, Kyle DeVere, the Chief of Staff of Waco Independent School District.
Thank you, Jackson. Appreciate you hosting us. And Senator, thank you for visiting Waco. I know that our superintendent would love to be here this afternoon. However, this happens to be the first day that we have teachers back on campus preparing for what's going to be a most unusual school year. And she had already committed to be on some of our campuses with our teachers today. Waco ISD received really 3 different pots of money through the CARES Act, and the largest was funds that came through the Elementary and Secondary School Emergency Relief Fund. For Waco ISD, that entitlement amounted to about $5 million, and what that did significantly was that it offset the budget gap that the state was seeing in public education funding. So while we received $5 million from that fund, we also saw, or just under $5 million, about $4.98 million, a similar reduction in the overall funding from the state. So that's significant because it meant that we didn't see overall a decline in where we were in terms of funding. Then we also had access to funding through 2 pieces of the Coronavirus Relief Fund. The first, the larger piece, was a 50% matching grant that the state set up that was just under $600,000 and paid for some Chromebooks, paid for mobile hotspots, important devices that are going to help us serve the about 56% of students who are saying that they want to start at least the first 6 weeks of the school year remotely and extend, particularly through those hotspots, access to the internet for those students, because that was one of the challenges that we encountered this spring. And then the last pool of funding, about $350,000, is reimbursements through the Coronavirus Relief Fund that are providing us the ability to move some of the expenses we incurred this spring when schools closed and we had to have a continuity and deploy new resources to keep continuity in our food service program, to keep continuity in instructional materials, at initially sending home paper packets and other materials. And so that's significant too, because that covered expenses up to May 20th at that first point in time when we were really looking at how do we solve this and keep the continuity. So we're certainly grateful for the additional funding that we've received from the CARES Act. It's significant that it helped the state to narrow that gap so that we didn't see truly a $5 million overall reduction in our funding. Thank you.
I'm happy to answer a few questions.
Some of the other areas aren't that lucky, especially we had a free testing event with MCC this weekend. We've gotten some of the results back, but still a lot of people are waiting. I spoke with people who have family members in nursing homes, and they can't go visit their family members because those family members are still waiting on results. You mentioned gold standard. Kind of speak to that and how we can maybe get a test that does get back faster and helps these situations.
Well, I think you alluded to it. The 2 things that jump out to me as a layman, I'm obviously not a medical doctor, but I would say accuracy and speed. And part of the challenge has been that as we've ramped up the ability to test, we're testing a lot more people, but we're not using a single test or platform. We're using a multitude of them. And we've, I think, wisely felt like it was important to deploy as many resources from as many places as you can to try to get ahead of this, get ahead of the virus. But it has created some challenges, to be sure. But I think we're in a much better place today than we were even a month ago or 2 months ago. We've learned that the importance of testing, but also the importance of getting testing back rapidly. But as we were just talking about the experience of Notre Dame, they tested 13,000 students, and 97% of them came back negative. And so they were able to isolate the positives, but then because of some failure to maintain social distancing, an outbreak of the virus took place. So a test will tell you today whether you're virus-free or not, but it won't tell you about tomorrow. And so in addition to the testing that's done here at the Community Health Center, what I think we all need to realize is that we have personal accountability and responsibility. We can stop the spread of this virus by doing the simple things like washing your hands, maintaining social distancing, masking when you can't, and staying home if you feel sick. And I think what's so encouraging to me is I hear The discussion about our students going back to school is that I think they will be the ones who will be able to demonstrate the best about how to do it the right way. But we know what to do. We just have to do it. Testing's important, but it's got to be accurate and it's got to be quick.
Senator, a bit in that same vein, talking about testing, here we've seen a drop-off in people getting tested. You talked about personal accountability, personal responsibility. Talk to me about people getting tested, making that decision to go get tested, because we talked about masks and washing hands, but asymptomatic cases are also a big issue with keeping tabs on this virus.
Well, this virus is full of ironies. You know, for example, our frontline healthcare workers at our hospitals, when we tell them you can't do elective surgery, then they have to end up laying off some healthcare personnel at the front line where this battle is being fought. So there's a lot of ironies. But I think the whole idea of testing has been, I mean, the fact that this is an asymptomatic virus among such a large number of people means that those people may not feel sick, so they may not feel the need to come get tested. But yet they can spread it to people who are vulnerable and for whom it could be ultimately fatal. So I think what we're beginning to see is things like happened in New York, a large antibody test, which has shown that about a quarter of the people tested actually had the antibodies, which means they had the virus and they recovered from it and they didn't even know they were sick. So the closest analogy I can think of is we're having to figure out how to design and build an airplane while we're flying it. And it's a challenge for everybody, but I think I'm proud of the good work being done at local level and state level and what we've tried to do at the federal level and provide the resources so we can get through this together as we will.
Senator, how will the next round of stimulus be different from the first round? What are we doing the next time that we didn't do the first time?
Well, I think some of it will be more of the same. I think there's going to be direct payments to individuals will be a part of it. It'll be income tested, so not everybody will get. Exactly. And then the Paycheck Protection Program, which has been the single most successful part of it from the standpoint of small businesses being able to retain their payroll and their employees, that should be part of it. I also think liability protection is important. This shouldn't be an opportunity to file a bunch of lawsuits over evolving guidance. I remember before April, the CDC, basically they said these weren't particularly helpful, but then they decided that yes, they were, and now you see we're all wearing them. So I think that's one reason why liability is important to not only universities, small businesses, nonprofits, and others. So those are three of the things that I would expect to see part of it, and it looks like we'll probably do something for the post office too.
That's good. You see, we expect the House to back under what, next week, and then you'll go to the Senate?
It sounds like it could be as early as this week, the end of this week, and then once they send it over to the Senate, then I expect these additional elements will be added to it, and we'll see if we can get it out of the Senate and then over to the House. Hopefully that will break the impasse.
When would you like to see President Trump put a signature on it?
This will have to be our last question.
I'm sorry, when?
What would you like to see, at what point, when would you like to, give me a date.
Yesterday.
Realistic.
Well, if in fact people are serious about coming up with another package, we ought to be able to do that by next week sometime.
Thank you all.
Thank you.
Good to see you again, sir.
Thank you.
Thank you again so much.
You bet. Well, thanks for hosting.
The world, and anytime you need anything from